95.9 KCHA, 1580 AM and 103.3 FM with The Weekend, something that's quickly approaching, Kay Winkleman, but we got a lot of sports, most importantly wrestling, to get through this week.
So I'm told.
Yeah. So
by our sports director.
we'll talk about that here in a bit. There's a lot to talk about. But first and foremost, more importantly of the day, who do we have in studio, Kay Winkleman?
Well, it is Floyd County Medical Center Tuesday update, and I am so excited about today's guest, Jill Connell. She is a family nurse practitioner, starting practice at Floyd County Medical Center, Floyd County Medical Center Clinic. Good morning.
Good morning, Kay. Thanks for having me.
Welcome to the studio, first of all, and welcome back.
So good to be back.
You have kind of come full circle. So let's start with your history. You were originally at the hospital and here in Floyd County. Talk about that part.
Sure. I was a nursing instructor for NIAC and brought students to Floyd County Medical Center. Had a wonderful experience, was welcomed by everyone. The students probably had their best rotation. Everybody from Viva Borschel, who was the CNO at the time, everybody made the students' experience amazing. And I thought, what a hidden gem we have here in this hospital. I was new to the community and wasn't really familiar with the hospital at all, and it was very eye-opening. We have a wonderful facility here in our community.
Yes, we do. So that was back in, what, 2010?
2010.
Okay.
Yep.
So you did that for a while, and then you took a leadership role over in Osage. You were there for 8 years?
Correct. I was director of acute care services, so I managed the med-surg unit, emergency room, outpatient treatment center, and hospice unit. And that opportunity gave me wonderful experience in rural health. I fell in love with it. I thought I would be bored, but with rural health, you wear many hats. You get to do many things. I drove the ambulance. I did everything. So it was really there where I fell in love with rural health and knew that's what I wanted to do.
Sure. And then you took a little bit of a stint. Of course, COVID then hit. So you were probably just bopping around doing COVID testing.
Correct.
For,
Correct.
18 months or so?
Yep. I worked at a COVID clinic where I did a lot of COVID exams and testing, which was quite an experience.
Yeah. You said, several months worth rolled into one whole year.
Yes.
And so now you are coming back full circle. You're going to be a nurse practitioner here at the clinic. What led you back here?
I knew I wanted to come back to this facility with the wonderful staff they have. The nurses are amazing. The providers are amazing. It's above and beyond. They care about their patients, and patients always come first. And I knew I wanted to be a part of that. I graduated in 2020, probably the worst time in history to graduate in the middle of a pandemic. But I just felt drawn to caring for the people of my community. I was fortunate enough to spend 6 months with Jody Heyer at the clinic. She was my preceptor, and she is absolutely amazing. And I knew from getting to know the whole team that I wanted to be a part of it.
Well, we are very blessed and excited to have you. In doing some research with Floyd County Medical Center, you have really discovered that there are so many services offered here that patients and maybe even some of our providers don't know about.
Yeah, I've been very impressed with all the services we can provide here in town, and that's our goal. We want to be able to keep our patients here in town. We know we can take care of them best, and we know them the best, so we want to keep them here and be able to meet all their needs. It's better for the patient, the continuity of care, that we provide these services here, and I think the new CEO, Dawnette, has an amazing vision for this hospital, and she is going to take it to the next level.
She absolutely is. Very, very impressed with her. So, pending all the red tape and paperwork, you'll start seeing patients probably in March.
Yeah, we're hoping for early March. It could be sooner, but that's the plan. We're at the mercy of when the paperwork goes through. But I've had the wonderful fortune of being able to follow providers around and see how everybody else does things. And I knew them, a little bit on the surface before, but now I've gotten to know everybody really well. And the skill level, the compassion is amazing. We have the best providers here, and they truly care so much about the patients of this community and the surrounding area.
We do, and now you're a part of it. Are they taking appointments for you at this point in time?
I think once it gets a little closer, they'll start taking appointments. I don't think they have started yet.
Okay.
They're just giving patients a heads up that it will probably be early March. That's what we're hoping.
One more family nurse practitioner amongst many wonderful providers at Floyd County Medical Center. I, for one, am so excited for you, and I'm glad you're full circle. I know you've raised your children here, and now your daughter, everybody knows Kiki Connell. She's Kiki Connell's mom.
Very blessed.
Known as Kiki Connell's mom, and Lauren Connell, and Gavin.
And Gavin and Reagan.
Not just Kiki, but
Yeah.
She is at Iowa State, so you're sticking around to be able to see her perform.
Yeah, she's running track and cross country, and she's really found her place. So I'm excited to see what amazing things she's going to do. And the others are right behind her. Lauren's a junior at UNI, and Gavin will graduate from UNI this spring. And Reagan graduated already from UNI. So I'm just thrilled to be able to stay in the community. It's part of God's plan, because I did interview elsewhere, and I kept getting led back here, and I'm just so blessed to be part of this amazing community.
Awesome. Well, thank you so much, Jill Connell. If you're interested in getting an appointment with her, you can contact the Floyd County Medical Center Clinic. She will start taking patients hopefully early March. So welcome, and glad to have you on board.
Thanks, Kay. Thanks for having me.
Thank you very much. It's 8:17. We have your North Iowa weather coming up.